The purpose of primary assessment is to determine any life-threatening injuries before moving on to a more detailed and thorough exam. This is supposed to be a rapid assessment that allows for any life-threatening injuries to be established. Primary assessment allows for the triaging of patients to take place, and it follows a list of steps that target the main causes of death. These steps are the following: airway, breathing, circulation, deformities, and environment. In this demonstration, the patient has just been checked into the ER, suffering from a gunshot wound to the right upper arm. And let's move on with the demonstration. As I said before, the patient has just checked themselves into the ER, suffering from a gunshot wound to the right arm. So immediately before they come in, I've already been wearing gloves to protect myself from whatever they have. Now I'm going to continue on with this demonstration. So like I said before, as I'm walking up to the patient, I know that their airway and breathing is okay because they walked themselves into the ER and are able to stand and talk fairly well. So I know that this patient is not going to die in the next 5 minutes. I am triaging them under the classification of urgent and not emergent. So now I can move on with this. So because it's a gunshot wound, I want to apply a direct circulation or a direct pressure onto the wound to stop the bleeding or to manage the bleeding until the doctor comes in. So to do that, I'm going to take gauze and I'm going to directly stuff this into the wound, and I'm gonna pack it in very tight, and then I'm going to wrap it tight. And you wanna apply a very direct pressure to ensure that this patient doesn't bleed out. And as I'm doing this, I'm noticing anything else that's wrong with the patient. I'm talking to them and making sure that their breathing is okay, and I can see that he has no other injuries, so I can put all my focus onto this. And then once this has been done, I would have already called the doctor. And once the doctor walks into the room, we can continue on with determining the patient's best plan of care. And that is it for this primary assessment.